Family peer support means having someone to walk the journey with me.
We're not alone. What family peer support means to me is hope. Hope and connection.
Being able to live in the present.
Being heard, being understood, and finding out that you're not alone. And having hope.
Hello, welcome to Montana's Peer Network Recovery Talks podcast. I'm Jim Haney.
Hi, I'm Beth Ayers.
And I'm Kayla Myers.
So today we are going to be talking to Beth and Kayla, and we're going to be talking about their work as family peer supporters, but really we're going to actually talk to them probably mostly, I'm thinking about being moms and navigating the system with children with special healthcare needs. What's that like? And kind of get into that conversation like a little deeper. But then I'm very curious also at the same time about their work as family supporters. And now that they're working, sort of, I'm going to say behind the curtains, you're on the inside. How does that look? And what does that look like? So I don't know how we want to jump in. We had really good discussion when we were warming up. And good material, but
I can share my story.
Yeah, if you want to start, Beth, that would be great, and then we'll get to the family support stuff.
Sure. So I am a mom of two children. I have a 24-year-old and a 19-year-old, and when my oldest was about 13, we had our first experience in the behavioral health. We went to the hospital, to the emergency room, and then to the psychiatric center, inpatient. And we spent probably the next 3 to 4 years trying to navigate the behavioral health system and all the different services and what was available and how insurance fit in. And through all of that and being very frustrated with it and feeling like I didn't have all the I didn't have the information that I should have had in order to make these choices for my child. So from that, I became a family peer supporter, and now I get to help families kind of have those questions or have that information ahead of time so that they can make choices for their children.
Okay, thank you, Beth. Thank you. A great introduction. Kayla, how about for you?
Yeah, so Beth and I kind of talk about this all the time, like our stories as moms during our journey navigating systems and diagnoses are very different from each other, but I still feel like a lot of the time we had the same feelings of hopelessness and frustration and sadness and grief and small wins that we've shared together. But my name is, I'm Kayla Myers, and I also am a family peer supporter. I have my own diagnoses, like my behavioral health diagnoses, and that I got later in life. And I have a child who's now 7, and he was diagnosed at 4, but started to regress when he was 2.5 with autism, and he is now nonverbal, and he has a diagnosis also of anxiety. So it was very surreal to have a child, hit all of his milestones, and he was talking and he was thriving. And then all of a sudden, slowly after his couple months after his second birthday, just started totally morphing and changing into a totally different child. He lost all of his words. He was very non-engaging. He was played with toys very oddly, lined things up. I was really the only one that could kind of come near him and his toys. And it was a very strange time to have one child. And then it's almost like you're grieving the child that you already have, but that child's still there, but it's a totally different parenting style. And that navigating that alone was very, very scary and hard. But
thank you for that. Another great introduction. So what as you reflect back here, it's been a few years for each of you, sounds like. And when you think back about the system, what was most frustrating? What comes to mind when we pick this topic to talk about today? What comes to mind? What was most frustrating as a mom?
For me, it was not being able to get the care that my child deserved or that she needed, either because of there weren't the services or the providers, there were long wait lists, insurance wouldn't cover things.
Like what kind of wait lists did you encounter?
Well, I'm trying to think back. It's been a long time. So after we
Mhm.
first went into the emergency room, we got connected with a psychiatrist. And because we were through the inpatient clinic, that happened fairly quickly. However, if we had wanted to be proactive and have a psychiatrist before we ended up in crisis, you're looking at least 6 months wait time. And I think that's how it was for everything. It was, if you want these services right now, first you have to be in crisis, then you go to the ER, then you go to the inpatient, and then you have, all the access you want to all of these services. I always wanted to not wait till it was a crisis and be proactive, but that's not how the services work. And that's not how our, the insurance that we had, wouldn't cover something unless the child showed that they desperately needed it. So like we couldn't show that they do. They had to first be in crisis and then they got access.
Because a parent wouldn't know when their child is in crisis, but
We don't want to be proactive.
no,
Right, right.
no.
Which flies against, I mean, the whole idea of things like recovery and wellness, preventative care, right? Which is, we want to be proactive. We don't want to spend a lot of money in the emergency room or emergencies type services. We want to get on the front end of it. It's interesting, Caleb. What about for you? What stands out for you?
Yeah, I kept bringing things up, but like I said, he was hitting milestones, and I kept bringing things up to doctors like, is it weird that he's not talking as much? Like his brother talked a lot more than he did at this age. Oh yeah, that's probably normal. We'll get him in speech. I really had to use my voice quite a bit and say, you know, I, I'm still a newish parent. Easton's only 5, but he was doing a lot different things at 5 or at 2.5, 3 years old. And the thing I think that was the most frustrating for me looking back now, at the time it wasn't frustrating because I would do it all over again. I was just being Bryce's mom and his advocate. Um, but I was having to call different entities myself. Nobody said, here, Kayla, here's the phone number list. Those big, long, annoying phone lists that they give you with all these numbers. I never got
Right.
a single one of those. I was
Hmm.
calling people that I knew that worked with children with special needs. My friend in Nevada runs a organization that or it's a state funded program that helps parents with the cost of therapy for children that have autism. So I called her. So I'm calling all these people, not talking to doctors. I'm not talking to therapists. I was having to get a hold of early childhood intervention, and I was having to call different therapists to see who had openings, and definitely got taken advantage of by a therapy center in town. Yeah, I mean, there's a lot of stories that are similar to mine within this. So what that also happens is there's these young children and these naive, scared, hopeless, overwhelmed parents. And then there's also entities that are taking advantage of these young,
Mm.
scared, or young children, scared, naive to how therapy works, how
Mhm.
it's billed out to insurance. Um, yeah, so I mean, looking back, I think that there was nobody to lean on to help guide me in the right way. I just had to start Googling and, um, kind of going full force into that, but no one was checking in on Bryce. No one was checking in on me. It was me having to just set forth and kind of do it on our own. So yeah, it was now looking back, I'm like, where was everybody? Where were all these professionals that should have been
Right.
stepping in and saying, oh no, this is what we're going to do and this is how we're going to do it? No, it was just me doing it. I did it.
Why do you think that the provider agencies didn't or don't? Why do you think that is? What's the barriers there?
I think, I mean, I don't know. I don't know exactly yet, but I think being a family peer supporter now and hearing different stories and hearing the things, from the referrals that I'm getting, they're in crisis. Like, it sounds like to the professional, they are also not, they have a child that is, either has a behavioral health diagnosis or a special needs diagnosis, but there's also other factors. There has to be other, like, food scarce factors or housing or finances or a single parent. It has to be this other dynamic for the parent to be looked at like, oh, hey, they could probably use a hand navigating the system. So
Yeah.
the parents that I'm hearing that don't know anything about family peer support within the place that I do family peer support,
Mhm.
they're there once a month, twice a month, and they've never
Mhm.
heard that there's a family peer supporter that could come and talk to them.
Mhm. Mhm.
And to me, the more I talk to those people, it's because they seem fine on the outside. They seem like they know what they're doing. They seem to be advocating enough for their child. They seem to be checking down some sort of list that, either the medical professionals or the therapist have. This is my assumption also.
Right. Right.
They
Right.
seem like they know what they're doing.
Yeah, you're kind of describing, the term the walking wounded, in mental health, right? It's people who are still functioning, they're still going to work, they still have families, but they're suffering in silence is what they're doing. Do you think that, because I wonder this in the behavioral health side, right? I don't have the same experience as the two of you as a parent, um, but I often wonder if there's a certain jadedness that just naturally comes into play for the professional, because the only people they're seeing are people who are coming in because something's wrong. And so it's like, instead of recognizing they all need help, it's like we're segmenting it into, well, this group over here, yeah, you're kind of okay, so we won't do anything with you. And you over here, you're kind of in the middle over here. And then, yeah, this little group over here, oh, yeah, you need lots of services. Because when I hear you say food scarcity, homelessness, that's crisis. If you don't have food and you don't have a home on top of having a child with a special healthcare need, that's already crisis mode. We're already in the most extreme state. And I just wonder if like that just sort of happens naturally to, counselors and doctors and stuff. And because it's like, that's the only people, it's like if you walk into an emergency room, I mean, some people are having a heart attack and they can die in the next like 10 minutes, right? But then there's other people who come in with different ailments and they're probably not going to die. It's uncomfortable, it's painful, or they need some stitches or something, but they're probably not going to die. And it's like, is there a natural human sort of element at play there that sort of like goes, yeah, you seem like you're okay, Kayla. You're on your own, and like, but you're really not, right?
Yeah.
You're really not.
No, and I didn't mean to, I'm glad that you pointed that out because I also have that same, urge in me to, with the families that I'm working with, when there are these other factors besides just, a diagnosis, yes, I agree. They're in crisis and they need guidance and they need support and they need someone to walk alongside them and help them, with all those different journeys that you have to walk down. But there also is other human beings in this world. Like, I guess, what did you just call the walking wounded?
Yeah.
I guess I very much was a walking wounded mom or human. And I think just having, someone's, and I understand too, like medical professionals and counselors and doctor, or, whoever, I understand that they're very busy themselves. And I'm not also talking poorly on them, because I know a lot of them in the setting that I work in are very compassionate, will stop what they're doing to listen. If I have a concern or a question about a family. I think the thing that frustrates me is why do people always have to be in crisis to need some sort of connection or some person, telling them, you're not alone, or it's going to be okay? Or why do people have to get to crisis for people to listen in the medical
Right.
field, in the service
Right.
field, in like,
Right.
why does that always have to be like, oh, now you're out of food? Okay, now we're listening. Why does
Yeah.
that have to be the barrier you have to get to for something to start moving along, and you being, plugged in with the people that you need to be plugged in with?
Well, Beth, you mentioned payers, insurance companies not paying unless your child was in quote unquote crisis. Yeah.
Yeah, even that to me doesn't make sense, because it is in the insurance's best interest to pay for preventative treatment or care versus acute care. I know that when our daughter would stay 2 or 3 days in the inpatient psychiatric unit, it was 30,000, 45,000.
Yeah. Yes. Yeah.
And this program that I was wanting her to get into for 6 months was 60,000. So would
For
you
6
rather
months.
for 6 months, right?
Right.
And
Right.
but no, we have to go spend 35,000 first for acute care, and then we'll spend the 60,000 for the treatment, but we won't do it the other way around. It's this whole, like, we don't want to
Right.
give them something that they might not need yet. Like, we want
Right.
to, and it's,
Right.
yeah, it's that crisis mentality. It's that,
Yeah.
waiting.
Yeah. Yeah. I mean, that's a great example right there, right? Of I've always wondered this. I'm somebody who had many 3-day stays in stabilization centers, behavioral health units. Why is it 3 days? Who chose 3 days? Who's the person who chose that? What's that based on? Because today the only thing it's based on is payers. That's what it's based on. It's all they'll pay for. It has nothing to do with the wellness of the individual. Some need 1 day, some need 3, some need 7, some need 30, some need 6 months. And that does not even factor in. I can remember working as a peer supporter, and I think I can talk about this because the place is closed now. So I was working in Bozeman in the community as a peer supporter, and they would actually discharge somebody on the 3rd day, wait an hour, and bring them back in and take them back through intake again and make them fill out the paperwork and the whole thing. They're already there. Like, it's really like, it's the opposite of how you would care for people, pay for a system. And then we face these issues today of workforce shortages, high turnover rates, right? Kayla, you were just sharing this about, you want to talk about that with the struggles you've had with your son and the people you're working with, right? You've gone through a whole bunch of folks.
Yeah. So when he was in ECI, which wasn't for very long, because like I said, so a regression period with a typical child happens between 18 to 24 months. So like right before that 2-year-old birthday. And ECI in the state of Montana is 0 to 3. I think it's pretty similar in other states as well. It's that early, childhood brain development stage. And since we got into the program closer to when he was 3, we were kind of late to the service game, and our our case worker or case manager, she was fantastic. She also had a child with special health needs, so I will add that. So I also got a case manager. I can't remember. I don't think that that's actually what they're called, but you know, basically she's overseeing the program that the state is funding.
Okay.
And she, you know, so I got that family peer support aspect with her. Like, yes, she worked for the state, you know, through a funding program, but she also had a child with special health needs. So she knew exactly what I was going through. She knew exactly what I was feeling. Even though our stories were different, she got it. And so that was my first example with services. And I was like, oh my goodness, I got so lucky. You know, I just felt so validated and heard and empowered, and, you know, all the things that I think we're trying to do within family peer support. But then he enters another program, and it's based on the children's disability. So the severity of their disability. So like, let's say a child has autism, but it's not as severe as like Bryce's autism. Well, they go way down lower on the totem pole, even though autism affects them the same way. It's just not as like loud to, you know, teachers or therapists or whoever, but it still affects the family unit and the child the same way as it would affect Bryce. Bryce might be more, you know, nonverbal and louder within his behaviors with, like, you know, making noises. I don't know. So that to me, number one, was a huge like, wow, so there's probably thousands of families in this state at 3 years old get cut from this other program, and then there's this waiting list to get into another program, and there's no services, support, check-ins, you know, nothing. And then so Bryce, yeah, since he's nonverbal, he's considered, you know, has more severe, so there's like 3 levels. So he got in not quickly, but rather quickly. And we were doing all the different check-ins, and every single time I'm like, why? Every time I got off the phone with them, I felt more depleted than I felt like they were helping me. I felt more drained and exhausted from having to like, okay, so what's Bryce doing? Even though at his clinic, you know, I'm like, can they just send you over the paperwork? Like, they already have his goals written. We already have all of this done. I've already sat with them and, you know, talked this out for hours. And they're like, oh no, we have to come up with our own, you know, own goals. So I'd have to sit on the phone with them after work. And then now I'm on to parent mode, and I'm having to sit on the phone and like do that every month, and do these check-ins. And, you know, they're not offering anything you ask for. Oh, is there something you like, can you help? They're like, oh, if you need anything, just let us know. Well, then you ask them and it's like, oh, that doesn't fall under our that doesn't, yeah, that doesn't, we don't do funding for that. And I'm like, well, then what? Because ECI would pay for Kelly Milius a play project. She comes in and does like play project. They would pay for her to come for her hour of time. Bryce got that through the state funding or federal funding, or yeah, I think it's federal funding. I'm sorry. But then, you know, then we go into this next level, and anything we ask for besides, I think one time they said, oh, do you think that he would benefit from some like flashcards? And I was like, sure, like I can get them at the dollars, you know. Yes, I'm not down with that.
Right. I can get them myself at the dollar store. Right. I can't pay for a play therapist at $200 an hour. I can get my own flashcards.
Yes, but then, you know, she came back the next time and said, oh, I have good news, the flashcards got approved. And I was like, cool, like,
right,
you are not helping me, you know. So but I also knew that it's important because, you know, they help with this waiver like later on down the road, that it's this big push. So that's where Bryce is at now. So 7 to 8, you can start the process to get on this waiver to you know, to set them up for funding for the future, because that also is a 7-year wait in the state of Montana. So you have to get them.
Wait. How long?
7. So yeah, 7 years to become.
7 years.
Yeah, 7 years, because there's only a limited available spots.
How old do you have to be to qualify for the program?
I believe that I think it's 10, but I think kids are having to wait till they're like close to like 15.
You'd be 17. You'd be 17 by the time your name came up, and then you turn 18 and then you're not eligible for the program.
Yeah, if you're still on the waiting list, no.
How can there be a waiting list for families that's 7 years long? How's that even possible?
I haven't, yeah, that is not a question for me.
See, that's the kind of yeah, no, right. I mean, I guess that's a rhetorical kind of thing. I'm just saying aloud because it's like, that makes no sense. If you're 10 years old and you get on a waiting list and you have to wait 7 years, they're basically just saying, we don't want to fund any children because we know you're just going to age out by the time you get done with the list. I mean, either A, you need to hire more people, or B, you need to add more money, or a combination of both. You need to add more money and more people so we can serve more.
Because then if you apply for SSI, if you make a certain amount of money, because like with Bryce, like the therapy costs for him are they're outrageous, even with private insurance.
What does that cost? What does it cost? Give us an idea.
Every year it could be, with like speech OT and he goes to ABA all day, I think it's like 50,000 a year.
50,000 a year.
So it's like basically a person's salary, if that.
Right.
And then my out of pocket is a little bit. No, I think within the program, I think it's like 150,000 to the insurance company a year. And then like the out of pocket to families would be like anywhere from like 30 to 50 with all the copays and so to insurance it's more. And also they don't, though, that type of therapy, a lot of the therapy places in town or in the state of Montana don't take Medicaid funding for that because they won't pay what they actually charge.
Right, because they pay so little. Right.
Yeah.
Right.
Yeah.
And so Beth, I'm going to ask you, I mean, you probably ran into this with your daughter.
What's that?
This issue, this same kind of issue. Well, I know within the mental health system, this is a major issue, right? Is that like, why would a psychiatrist work for a state-funded program for $100 an hour when they could work on their own for $350 an hour? Like, so what happens is it means that the really good psychiatrists go out on their own, and then who are you left with in the system, right?
Yeah, like the newbies.
Yeah, who are just cutting their teeth. I mean, they're just learning, so they're not as knowledgeable, they're not as experienced, they don't have the bedside manner. They're mostly straight out of college, and they are just there to do their time, so to speak. And then they're moving on with the turnover rate, right? Which is, I'm just going to do my time, and then I'm going to move on to another job. And now the company is back to the starting gates. Oh, we got to go hire somebody again, right?
When my daughter was in the inpatient unit and then also doing her psychiatry at the same organization, that was about 10 years ago. There's not a single person there that was there when we were there. They've either retired or they have left.
Meaning all the staff turned over within a 10-year. Yeah, within a 10-year period.
Yeah, the psychiatrist did. Yeah. And for behavioral health, it might be a little different with Medicaid. We were encouraged to quit a job and get on Medicaid so that her treatment would be covered, and it would be covered for a long period of time, as opposed to private insurance that's going to say, okay, your child, in residential treatment needs to be there, 2 weeks. How long does it take for the med change? Sort of thing. We were encouraged, if we wanted, her to have quality care, to get on to, quit a job and get on Medicaid.
So what did you think about that when that was suggested to you? What did you and your husband think about that?
I think we did whatever we could to help her. So if that's what, so if that's what they said to do. And so, we kept our income low And then even after the treatment program, we purposely kept it low so that she could have quality care. And so it's like, yeah, it isn't.
It's so backwards, right?
There was never a meeting or a decision in any of her environments, whether that's in the school or hospital or treatment center. There was never once a decision that was made on what is the best for this child. It was, how much is it going to cost? Who's it going to cost? Do we really need to do this? We don't have enough, we don't have enough people to handle this. There was never, it wasn't ever about her and her care.
How frustrating was that for you?
It was awful. It was, you're just running. I just felt like I was in a system. I felt like I had a child that at any moment could be in crisis, could take her own life. And it didn't matter. I didn't feel any better whether we were in the system or out of the system. It was like, no matter the supports or the services, I didn't ever, I didn't ever feel like, okay, this kid is helped and there is something in place. It was just like, we were there to protect her, and that was it. And it was tough.
You carry that with you as a family peer supporter?
Yeah, as a family peer supporter dealing with some of the same situations with the families, it's just so aggravating. It just makes you want to cry. In fact, I've cried as a family peer supporter because the injustice of it and the way that families are treated, especially in the behavioral health part of it. Most people who we came into contact with did not understand behavioral health as a health
issue,
physical health condition. Right. It was, what are you doing at home? How are you parenting her? Maybe you should try this, maybe you should try that. And that's just, I think, how it is. I feel like as a society, we're getting a lot more, we're able to view mental health as health, but you don't get the same, you just have to really you have to fight for everything, because they physically, from the outside looking, from the inside, from people on the outside, everything looks fine. They're healthy, physically able, they're smart. That's a hard one too. If your child is smart, then if they have a behavioral health diagnosis, they won't get put into the school's special education programs because they're smart. They don't need it. And so it's frustrating. I think that as a parent, I definitely felt blamed. And then I probably blamed myself more than anybody else, because it's like, I look at her, who looks exactly the same as all these other children in her class, and these other children are able to do whatever they're asked to do, and mine isn't. And so really the only difference I thought was, well, they have different parents than mine has, so it has to be our fault. And so that's just a hard thing.
You and I have talked about this, I think, on another podcast. We talked kind of about that particular aspect. And it must be very, very challenging. It's interesting, what you said there about being smart, and as if that is some sort of measurement for your mental well-being. Like it's basically saying, like, if you're not smart, then you're not healthy mentally. But if you're smart, you don't really need much help. Like,
It's a choice. You're
it's like-
choosing this.
It's like, that is so backwards. And I, you know, I'm curious about this part, and I'm glad you're both sharing this, your roles as peer supporters, because I know for me, when I started as a peer supporter and I got to see behind the curtains, sitting in a staff meeting in a mental health center with all these people with degrees, you know, it was a little bit intimidating at first, but I was shocked at the way they talked about the clients, my peers, and talked negatively about them, talked down about them. The talk was not about their care and how to help elevate them. It was like very degrading and very off-putting to me, and very what you're kind of saying, which a lot of like blaming and, oh, they're just being manipulative and these kinds of things. It was really hard for me. And at that time, there weren't many peer supporters in the state. And I would sit in these meetings and I just was like, man, I would hate those staff meetings, because it was like I was the only one, you know, like, am I the only one hearing this? Like, it was the culture. And I thought, is this how they talked about me? I used to go to a mental health center, you know, is this how people talked about me? And I think this is a whole nother issue within the behavioral health system that has to do with things like burnout and turnover, and not celebrating the successes that you have, whether you're a psychiatrist, a counselor, a nurse, a peer supporter, whatever. There has to be some recognition of the successes to help balance out the very difficult work that's being done. And that's something that I've been thinking a lot about, because it's been so many years now and I just keep seeing and hearing the same types of things. And it's like, how do we solve the burnout piece for people who are working in this field? I mean, you're both working in this field now. How do we keep people like you working for the next 10 years and not burn you out in the next year? And then the families you work with are going to go through the exact same thing you went through, which is this turnover.
Mm-hmm.
Like, how do we do that? We have to create a healthier culture within the service providers.
Yeah.
Right? Where, right?
Yeah. I think if I was only working outside of recovery organization, I was just working with, you know, in a clinic or in a hospital setting, yeah, I don't think I would last. But because we're working here at MPN, also, we get that self-care. We're around people that understand. We're around people that, you know, care about our health, our whole health. I think that's honestly what keeps me there. And it's something I brought up at a commission meeting I was at not too long ago, was the children and the families who are getting served by these organizations are the ones that need somebody there to be, you know, long-term, long-lasting, you know, stability. And they're the ones that have the highest turnover rate. And it's because they come in with little training. They're given way too many families because, you know, they're short-staffed, but they're short-staffed because they keep piling, you know, families onto the new person all the time, you know, so they don't have enough workers or training. And then, they don't know how to maybe care for themselves within this profession. It's a tough spot, and the turnover rate is high, super high. And the children and the families are the ones that really, you know, get the raw end of the deal, because they're depending on this service or this provider to support them. And, you know, when so-and-so isn't there anymore and you get somebody new, or there isn't that, you know, we can't help with that, or it's hard.
Yeah. I would say, so like going back to the thing you were asked, I just had a thought while you guys were talking. So yes, working within a clinic environment, it, I would say the ones that I get the most, like my heartstrings are just like, ripping out of me. And like, when did we get so far away at looking at, these children and their parents
Mhm.
for the big, like not like yes, we're looking at the behavior. Like, oh, they said they're going to hit the dog with a stick. It's not anything that ever happened within, I'm just thinking of an example.
Mhm.
And then, we're not looking at the child or the parent, like what is the behavior, what is behind that behavior, what are they trying to tell us? And so like I don't have a degree in I'm not a psychiatrist, I'm
Right.
not a doctor, I'm
Right.
not a counselor, but I have lived experience of complex, CPTSD. I have ADHD that was diagnosed way later in life. And when these families come through and I'm working with them, and there's these big long notes and they're just these like big, there's these big crisis plans and like in an emergency, bring them. And I understand that that's important, but I can look at it and say like, well, yeah, why, no wonder they're acting like that. They have severe trauma in their past. Why aren't
Mhm.
they being treated for their trauma?
Mhm.
And why are they being, put on all these medications?
Mhm.
And why is the plan to take them to the emergency room? Why aren't we getting, somebody to sit down with them and talk to? I don't know. It's just, to me, and I know that it's case by case. I'm not saying that I know all or I know best. It's just very easy for me to, because I have that lived experience
Mhm.
with, not only myself, but, my younger brother, like we have different stories, but, we were a part of both of our stories. And to me, it seems so, it's not as complex as these systems of care, I feel like are making them, if that makes sense. I think the root of all of these behaviors is trauma. And if the trauma is treated, I would be amazed to see what would happen.
Mhm. Mhm. Yeah, I mean, we've definitely, right, we've built this super complex system that even as people who work in this field, we have a hard time navigating and understanding all the acronyms and all the departments and
Absolutely.
all the, right? How does a new mom, you know, enter into the system for the first time and navigate this whole thing? It seems impossible. I mean, I've been doing this for 15 years and I have a fairly good grasp on the system, but I don't know all the different parts of it. I I just don't, it just seems like we've made this, what you said, it's like been made way too difficult. And
Because I
we've,
do think there's cases where, the diagnosis is just like anxiety and severe depression. Like I do think there's those
it's
cases
simple.
where,
Yeah,
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 like, yes,
yeah,
those are, but then it's
yeah,
like, there's other cases where it's like, oh, all this stuff happened. And then now they're behaving this way and we have no idea. And it's like, just this like, oh my God, I cannot believe this,
right,
this person's acting like this. I'm like, well, of course they're acting like this. Like
right,
to me, when they're talking about it, they
right.
make it sound so like it doesn't make sense. I'm like, it makes perfect sense to
Yeah.
me. They're hurting. They need to. So that's what I'm saying is like, yes, there are cases. Yes, they just have anxiety and they have depression, and it's very simple and straight laced. But I feel like everything has just become so like convoluted, like to, where there's, oh, they must have trauma or the parent must not be doing well. No, there are cases where, the diagnosis, the chemical imbalance in them it's anxiety and it's depression and it's, ADHD and it's autism. But then there's, I don't know. I think that's what I feel the most power in being a family peer supporter, is that at least in those cases, like I am there to say, whoa, whoa, hold up a sec. Like, why aren't we going back to what happened in the past? Why are we focusing on these, behaviors that are arising now? Why, like, I think that's where, so I feel empowered to do that and to, kind of open up the family's discussion about like, let's go back to that and let's heal that and let's walk through that and then see kind of what happens within the family unit and the family environment. Not that I would help them heal. I'm just saying like, let's let me help you navigate the systems that can help you heal. And yeah, I don't know.
I think we have a unique perspective because we're not focused on the psychiatry part or the, primary care provider. I mean, we don't have these things that we are, really focused on because that's what we're supposed to be doing.
Yeah.
We really have this, ability to kind of, see everything as a whole. And I think when you've experienced it, you offer people a lot more grace and you offer people a lot more help and support. I know I have overheard conversations about, well, this mom didn't bring her child to the appointment and they always miss their appointment. And it's always something like, oh, my car, or, oh, this, well, just get it together, put it down on a calendar, And I just want to say, well, for you, taking your child to the doctor may be very easy, but to a mom who is working and raising her children and her children have behavioral health challenges, so she is like putting 10 times more energy into this child, parenting the child, and then probably has her own, mental health too. And yeah, just needs some help, just needs someone to call and say, hey, don't forget about your, appointment. And it isn't a choice sometimes. And this idea of like, well, you should just be able to, to do better.
Yeah.
Does not take health into account.
An example of that is like, yes, I'm a family peer supporter and Beth is my, we work together. But even so, like I brought Bryce to the clinic recently because he had an appointment and she said, what time's the appointment? And I said, I bet you'll hear him before I don't even need to tell you what time it is. And we walked in the front doors and he was like, walked in and he was like, yeah, no, thank you. And like scooted past all these people and started to try to like run out of the clinic. So I like got him back in and he was just like, oh God. And out came Beth and just like seeing her face took like, a tiny bit of that like pressure off of like, oh God, Bryce is gonna like, he's gonna try to run out the door. He's gonna, be sitting here looking at the fish and then he's gonna, I don't know, like even just, yes, she's my coworker and yes, she already knows Bryce. But even just having that person to like walk out that door and be like, hey, hi Bryce, how's it going? And acknowledge Bryce for Bryce and not like, oh gosh, that kid with autism is down there being really loud or, even that, just like her smile and her, sitting with us while we were in the waiting room, because even just the waiting room feels like an hour sometimes when it's only a 10-minute wait with a child with autism because they have such, bad anxiety. So I even had my own personal experience with that, with Beth, with Bryce recently. And even just that weight that lifted off, that 10 minutes was monumental.
Yeah.
Well, and Kayla, when you were first hired, it was maybe your first day, maybe your second day, and all of the providers are in a staff meeting or something. It's kind of lunchtime, kind of whatever. And there is a very loud child in a waiting room who has been waiting a very long time and very loud. And Kayla was the only one to be like, I am going to go help this mom. Like, something's going on and I'm going to go help her. And she went and she got, things for the kid to do, stickers and toys. And just that poor mom, I'm sure in the waiting room felt mortified that her child is in there screaming. And I'm sure people were like, what's going on there?
Right.
The mom needs to get a handle on it. But Kayla goes in and just supports the mom. And I think the mom even started crying.
Yeah, the kid didn't want me in there either, but I was like, I'm not scared. I could tell also, I think now like movements and tones and voices, I bet they have autism. Like I could hear it through like doors and or just those subtle things that you learn through your own lived experiences. But yeah, then the mom actually got to like sit and talk to the doctor and wasn't like flustered and yeah. So I think it's just important. It's important to have and there's so many other factors that come with it where like with Bryce, like he doesn't want to get on the scale. He doesn't want to be like there's these weird, to other people it might seem weird, but to them that's just overwhelming. I don't want to go stand on that big thing and then have you put that stick on my head and I don't want that. And and I think because I don't think that it's everybody in the medical field. I just think it's just like they're in, they're out, next patient, they're in, they're out, next patient. I don't think it's a personal.
It's because of billing.
Yeah, I don't think it's a personal thing.
Well, that's what I'm hearing. I mean, do we need to rethink the way we train people, the way we educate them in college to have more focus on this human aspect, right? Because I'm hearing you both say, as family peer supporters, I have this unique experience and I can intervene in these situations. I mean, if we're spending, and now the federal government's even going to pay for your college tuition, evidently. So if we're paying for this, then maybe we need to rethink that too. Maybe we need to rethink the way we're teaching people and say it needs to be more trauma informed. It needs to be more about a lived experience and the value that that can bring to your practice, and quit this nonsense with production and numbers, right? Like a doctor can only spend 7 minutes with a client, but like that stuff is ridiculous. And we need to start putting our foot down to say, we're not going to do that anymore. We're going to do it a different way. And maybe we'll get better outcomes in 10 years instead of this, just what we have now, because to me, it's just a giant mess. I mean, I can't even navigate my own Blue Cross Blue Shield. I mean, I can't and it's just me. It's like, I got to pick a doctor and I don't know, there's like a gazillion faces on the screen and I got to pick one and I don't know which is which and which has a waiting list. And like, it's super complicated. And it's like, we've really made a mess of, in my opinion, of healthcare in particular. If we talk about behavioral healthcare, kids with special healthcare needs. And if we need to be focused on anybody, we need to be focused on the kids and the families. Health, well, preventative health.
We need more patches, doctors.
It is complicated, and when you're new to it, you don't know what is, I don't know, is this how it's supposed to be? I don't know. I have no. So an example was when I was in the ER with a mom. Had she been in that ER herself without anybody and treated the way she was treated, she would have walked out of there, feeling like, well, I guess that's just how it is. This is, I should be doing better. It is all my fault. But having somebody there to say, no, this is not about you. This was not okay. This was not good healthcare. Is so, I mean, even if the healthcare doesn't change, at least it isn't you. And what you can expect, what you should be having, what your children should be, what sort of services, your child should have. But when you don't know, you trust who's ever in front of you, that they're explaining it all and they're telling you all about it. And they're kind of the experts too. I mean, there's a factor there too. When you go into a facility, you make the assumption, we all do this, we make the assumption that the people who work there are the experts and I don't know. Like that's how most people walk into a hospital or a doctor's office and you're just like, well, they know. And so if they tell me this, that must be true.
And I think once you begin working on the other side, you begin realizing, no, that's actually not how it is. The people working here have mental illnesses and substance use issues and special health care needs, and, and some are not that educated. And
And when
Well,
you
and sometimes even just
Yeah.
getting to the appointment, like you almost like this, like not like blackout in a like, but like almost this blackout thing comes over you as a mom or a caregiver or a parent, where you're like there and you're like, yeah, 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 yeah. But there's like no
Yeah.
retention and there's no memory of
Yeah.
like, oh, I needed to ask, this or this and this. So even just having like a family peer supporter or somebody else with you, like in the room,
Yeah.
so they can focus, or, hey, what did they say about this, to
Yeah.
me? And I can say,
Yeah.
oh, I don't remember, but let me go clarify. Or they said X, Y, or Z. I don't know.
Or let me look in this book I have that I
Yeah.
wrote everything
Yeah.
down in, right? So let's wrap up by talking a little bit about that. So that we've had this kind of conversation many a times, and uh the two of you got together, and our other family peer supporter Aaron got together and created a new book. And do you want to talk about that and what that's all about? And
go for it.
You want me to do it?
yeah, tell us.
Um, yeah. So we, I don't remember what we were talking about a long time ago, but I was talking about that first initial, person at ECI that also had a child with special health care needs, to Jim and Beth and Aaron and kind of the group. And I said, half the time I didn't even know what was happening myself, like we've been talking about. I didn't know the questions to even be asking. I didn't even know. And I got so overwhelmed, or I was like emotional. And so this her name was Tressa, and I know she'd be okay with me sharing who she was. She just gave me this like regular notebook, and she's like, you're gonna like take notes if there's things I say, just like write it down so that it's somewhere. And then if you have questions for me later, or if you and then Jim kind of stopped me after a while, and he's like, what kind of notebook was it? I was like, I don't know. I was just talking, and I said, I think it was just like a regular notebook. And we all kind of just got talking. And then Aaron said, oh, there is, there's these different like sheets that I've seen where like all of the information can be compiled. And so we got talking more and more. And I was like, how cool would that be if we made our own book with all of our experiences with being parents and navigating systems of care ourselves, and put a book together for parents and children to go be the best advocates that they can be for themselves, because when they get to the appointment, all this information is in this book. So we did it, and we made a book called the Lifeline Notebook. And yeah, and we're so excited.
Lifeline Notebook. Yep. And it's available on our website, mtpeernetwork.org. You can go to the store. It's up there now. It can be ordered. They're $20, and it's kind of cool. On the cover, there's a big life preserver. The Lifeline Notebook, a notebook designed by and for parents and caregivers of children with special health care needs. And yeah, I know when we were having that conversation and talking about it and editing it and all of that, I could tell all of you were drawing on your actual experiences to say, oh, we need to have this in there, or we need to have that, or that doesn't work quite right, it needs to look a little different, or that kind of thing. And so it's neat to see something go through the whole, from, hey, that would be cool to do, to, boom, like here it is now. It's here, it's available, and it's a tool, right, for families to be able to utilize.
But also having an amazing boss that listens to us, Jim, and
Oh, stop.
seriously, and says like, wait, that would be helpful for you guys. Okay, let's do it.
Yeah,
It's true.
That's just common sense.
That's what's great about our job. No, Jim. I think that's what's great about our job is, as parents, we have the capacity, since this is our job, to really be able to take the tools that would have been helpful for us
Yeah.
and put them in for families. Because as a family, when you're navigating your child's healthcare, you just don't have the capacity to be creative or to think, hey, I think this
Right.
would be a great idea. And so that's, I think, one of the great things is we get to have for folks what we wish we would have, and we also get to support folks like when we were walking through it, we wish
Yeah.
that we had.
Thanks for the work that you do. It's so important, and it is hopefully changing the system. Sometimes that's hard to see, but it is. You're definitely having an impact on families and children, and we'll keep advocating here. We'll keep advocating and working towards the bigger systems change, right? And having peer supporters within agencies is the best way to do it, right? Like, you can advocate from the outside, stand out on the street and yell and shout and have a sign, a picket sign and all that. And that might do something, but having somebody on the inside changes things from the inside out, right? You rub off on the other staff and the clients, and right. And then that begins to change things like policy and culture. And I want to see it commonplace. And I want to see the state of Montana step up and fund family peer support fully the way it's funded behavioral health peer support, so that we can have folks like the two of you working in all the different agencies who serve families. That it shouldn't be limited to just a few places. It should be widely available. And so in order for that to happen, the system has to commit, both the system in terms of the state of Montana, Department of Health and Human Services, but also private insurance. Because when I heard you say that, Beth, about, oh, hey, just have one income, make less money for your family, and then we'll give you some services. That is so backwards. That's the system telling you to be less than so you can get proper care, right? It's like, it's completely, it's like be less than, don't try to achieve more, don't try to raise my family up just to get basic health care. And those are the kinds of things that, as we start doing this new format with our podcast, these are exactly the topics that we're going to talk about on this show. And we're going to keep on talking about them, and we're going to start highlighting stuff like this and really get in depth. And I really enjoyed this conversation today. And I really thank you both for being so open and vulnerable. But this is the only way I think we're going to do it, is by sort of shining a spotlight onto these things and raising people's awareness. If you don't have a child with special healthcare needs, you probably have no idea. You probably have no idea that the system is so difficult to navigate. So we need to tell these stories, and there's all kinds of parts of the story that we need to tell and highlight and talk about. And it's not that the three of us have the answers. We don't have the answers, but we're offering some solutions, like family peer support, like a notebook, right? I mean, these are inexpensive, really, in the big scheme of things. And so I really call on DPHHS to step up, and they need to start funding this widespread across the state and stop talking about it and saying we should have more meetings and things like that. Every quarter, we're going to have a meeting. Just do it. Just put it into place.
Yeah.
Find a way. That's what happened with behavioral health peer support. That was the lingering question for 5 years as we met and were developing behavioral health peer supporters. Everybody kept asking, every meeting, somebody would ask, well, how are we going to pay for it all? Oh my gosh, what are we going to do? And it's like, we'll figure that out later. Like, we need to build the structure and we'll figure that out. And sure enough, it got all figured out. And so that's what we need for family peer support.
And we need funding that isn't for a specific population.
Yes.
We need to not have to say to families, well, lower your income.
Yes.
And if you're, on Medicaid, you can have this service. It should be
That's
available
right.
to
That's
everybody.
Right. That's terrible that we do that to people. That's really that is like, that's terrible. That's not something that shouldn't even enter the conversation.
I think it'd be interesting to
Right.
see if these systems, you know, intricated peer support, family peer support, just how much money they would be saving in so many different areas. Like I know it within,
Yeah.
I mean, I don't have the actual statistics or like the percentages or the dollar amounts, but I know in my heart and soul that it would save, you know, because like just look at when funding gets cut in so many areas, you start to see
Yeah.
crime, you know, all of those
Yeah.
things increase, and I know it in my heart and soul
Yeah.
that they would see such a decrease in so many other things.
For sure. For
Yeah.
sure. Absolutely. Absolutely. All right. Well, thank you for coming on. And
Thank you.
and you both will definitely be back on future podcasts, and we'll be talking about different stuff. And I also want to say thank you to the listener. We need your support. We need you to tell people about what we're doing. Montana's Peer Network, the recovery movement, family peer support, you know, and keep tuning in and tell your friends about it so that they listen in. It's important. We're going to keep bringing you stuff just like this. If you have ideas or you want to come on and be a guest and talk about something, experiences you've own had, reach out to us. Okay. And go to our website, or you can email us info@mtpeernetwork.org and let us know what you got on your mind. We're always looking for stuff, and we'll keep putting these out and keep doing good work. So thank you, and we'll catch you on the next podcast.
What family peer support means to me is being the person that I wish that I would have had when I was walking a very lonely and isolating road.